Today we continue our discussion of the link between posture and elimination. Hi, I'm Dr. Peter Minke. This is Minke Wellness. And particularly what we're talking about right today is the colon, right? So we need to eliminate, we need the colon to work. We've talked previously about the massage for the peristalsis to help the colon get going. And I'm going to show you that again just in review. So let's talk a little bit about, again, the posture, the body posture position, how we sit, the shape of our body, and how that is impacting the colon. We know that I've told you that the tube is this long flexible tube, and so anything that crunches down across that structurally is going to have a restriction or an impact to the peristalsis wave. It's that contraction as it goes down the tube, and that's what pushes the material down the tube, and it doesn't just go on its own. It has to be pushed out. So this upper body. Let me go get you a view of this again. So all this upper body compressing down, and a lot of times people will have a lot of arm tension, a lot of upper body tension as they're doing typing and mousing, and it just builds up, and then they go to the gym. A lot of guys will go to the gym and work this part out, and it gets shorter and tighter, and this becomes this block of weight that kind of crunches down, and we shear across the transverse colon here. We could even have problems which we've mentioned before with hiatal hernia, where the stomach is there's nowhere for it to go. So this pressure coming up through the diaphragm, which causes the stomach to pooch through. So we really want to stay long, right? And that's that in choir. If you ever were in choir, you're told to sit on the front of your chair and drop your knees and allow this to get longer. Well, that's going to be the same position we need to use for good digestion, good elimination. The problem with toilets, if you're tall, you sit on a toilet, and it's this, and then there's a hole in the middle, of course, which everything is, and it's all slumped down, and here I am trying to encourage the peristaltic wave to push material out, and at this point, it's almost having to push uphill because the sigmoid colon, again, comes down and deep, and then, and then the rectum comes out that way. So it's one of those situations where we're just not helping ourselves structurally and honoring the natural process. So I want to talk to you a little bit about this natural process of elimination and how it works structurally. And so, like I said, we want our body to be, a little bit more upright. We want our chest to be deep enough so that it holds its structure is integrated with the rest of the body. It's going to require body work. It's not something you're going to do. Things like yoga and stuff can help, but most people are so restricted in deep layers that they can't touch or stretch with yoga. Or any modality without getting hands-on. So you probably just need some massage or Aston patterning work or whichever system you want to use. Okay, so let me go over that peristalsis massage that we were talking about last couple videos ago. And again, I'm going to be down here, and if I come on the inside, deep down, right here's the hip joint, right? Here's the hip joint right here. The femur head is coming in here, and I come inside the hip crest, and here's where the appendix would be, way down low, and I'm going to scoop in and lift, and you should feel, if you do this correctly, you should feel that sort of relaxation as we lift up and pull that, just gently pull that thing, and then we're going to allow that, and then breathe and pull that wave, encourage that wave to come on up, and then catch the back to come around, because there's where it bends around to the hepatic flexor, and then we're kind of doing this hand over hand motion gently, and this tends to be a little more sensitive over here where the gallbladder tends to be in here. The gallbladder referral patterns are all right up in here. So here's the rib cage, right? Here's the sternum. Come down at the end of the sternum, you got that xiphoid process right here. You don't want to push too hard on that. But we come down 2 inches below that, and we got that transverse colon sitting. So I'm going to just kind of, again, lift. So I could take that and lift the colon there. Okay, and then come around and go down the descending colon, and just gentle massage. Get down into that inside hip where the sigmoid colon begins, and then pull up, and again pull up and wobble a little bit. I use my breath to pull up, over and down. So here we go, and then down to the rectum, and I'm going to go ahead and use that breath to go to the rectum and all the way, feel it all the way to the anus. So that's the little bit of massage. So what happens if sometimes you get constipated, and if you're having to force out the poop, that's not a good thing, and you want to be able to have, just as you relax, the peristalsis wave comes out. And there's so many people that's not true, that it doesn't happen that way, and they have to literally push it out. And so we contract the abdominal muscles and push down and out, and most of the time people are thinking about it in a linear fashion. It's just a line, pushing in one line, just going straight. Well, let me give you a little tip on how to help your body eliminate, even if it's kind of hard. You don't want to just push in some straight line. If you kind of allow your pelvis to go, if you think about this in a spiral, and allow yourself to go and move, and I'm going to have to show you this, so that, if you're on this is the technique, if you're on the potty, and you kind of just go back and forth in a spiral. Think about a spiral. So you're coming into the sigmoid colon in here, and forward, and then back, and then into the sigmoid colon, and forward and back. So you can use your body weight going from right over to left, and then the weight of your front to go down to put pressure on that colon, sigmoid colon, to contract. You want to be up here. This contracting of the abdominal muscles generally shortens this, and actually ends up just putting a lot of pressure down here with something that is trying to get around a curve. And so here we are contracting linearly for something that needs to curve. So if we just follow that curve, right, and just at some level, you can put your one foot in front of the other. Typically it probably works for both ways, but when you're on the toilet, put one foot forward and one foot back. Do a little support off your feet, and then rotate, relax and rotate. See if you can help. This has been this idea of spiral, because that's actually how the poop comes out, and it's not this linear thing. It's going down and out through these curves. That is actually the same technique I teach pregnant women for labor, that the baby doesn't come out in a straight line. It is a spiral process where the baby turns and curves down the thing. So if you follow that in labor, your uterus is going to contract and rotate, contract and rotate. And if you don't fight that, if you relax into the contraction and allow the body to become the vehicle, the support system for the uterus that's doing the work. So here's the similarity is really, really strong. In the case of the elimination, I'm talking about the colon is doing the work, and my body becomes the support around the colon. So my colon is the focus at the time I'm trying to poop, and I'm allowing that to happen, and I allow the body to move. And I know it sounds weird, but it really works, and it really saves you the potential risk of blowing out the anus area and getting varicose veins, which is to say hemorrhoids, and all that. Well, in the delivery process, I've had so many women. I've literally told people this 5 minutes conversation after church, and then a few days later they go into labor and they remembered what I said, and they said labor went so much easier if you don't fight the contraction. Here's this contraction, and then we're trying to push, and they're saying push, all the rest of that. I said, most of the time in that whole labor process, if you just relax and let the uterus do the job, and you let your body go with that, you'll find that the baby spirals out, and there's not all this linear pushing. The body is not linear. It doesn't work that way. Okay, so I know it's a little aside about pregnancy, but in a way that's an elimination, I know that I'm not trying to be offensive. But it is a process of getting something out, and it's a very important process for the baby. Let me just go on a quick aside. It's really important to have a vaginal birth for many reasons. The head contracts, and then the lungs contract, and it all goes in an area where blood is being squeezed through the system, and then it comes out and expands. And then when the baby, the baby is delivered, you want to make sure you don't cut the cord too soon. That blood that's in the cord is supposed to fill the head, it's supposed to fill the body from that contraction, and it's supposed to expand back out. So you want to wait until that cord is no longer red. It's not pulsing. It's done. It's kind of a little bit dry. And so they take the baby, put it on the breast, still attached to the cord, and then that also the vaginal birth for the baby gives the baby the flora, the biome, flora, the gut flora that's going to help establish the whole gut microbial probiotic and all that stuff. So anyway, I know that's an aside. Back to elimination. So I just wanted to share with you this technique, though. It's the same, like I said, it's the same for delivery of a baby, but hopefully your poop isn't quite that big, and I'm not going to make that comparison as being equal. But the peristaltic wave, if you can learn to feel it and get in touch with it, do some massage, use some essential oils, do your breathing, but and sit in a way that actually helps give the colon the space. All of those things will contribute so that you can allow the poop to come out, and it is very important. Once you get tone in there, it really is amazing what the organs can do if they just get a little help and support. That's all we're asking for here. Okay, so I hope this is helpful for those who have trouble with the elimination, but this connection between posture and elimination is very clear, very real, and you know this. And if you fly in an airplane, not only is the air extremely dehydrated, but the sitting in the seat makes you constipated because it just collapses everything down. So there's a lot of vehicle travel. You got a lot of micro vibrations on the road, and little vibrations, and the body's just sitting there compacting down like a sand compactor. And all the tissue gets dehydrated in the joints and everything. So really important when you're driving and flying, get up and walk around a little bit, because all those compressions, and then you end up with that compression right down through the gut, and they end up with the constipation structurally because the body's not moving. Okay, so these are just some little tidbits about life and how to move along in life. Okay, all right. I hope this has been helpful. Happy wellness, one day at a time. We'll see you tomorrow.